Hi everyone, this is Aditya coming to you with one of our word skills lectures. This is one of 4 lectures that's going to key in on some core skills that are going to help you over the course of the month and put them into context with our medical topics as we go forward. So our first topic is going to be about time management. How do we manage our morning as a new intern or a sub-I? So we're going to review a timeline for pre-rounding. We're going to identify the 4 required daily tasks. We're going to prioritize these tasks, construct strategies to keep us organized, identify which individuals we want to talk to in the morning, and then we're going to spend some time looking at how much time to spend in the room examining and interviewing patients. We're going to review morning orders, and most importantly, I think one of the big things we're going to talk about in this lecture is how to call consults. So this is your general timeline for what you should be doing when you get in. So we're hoping that you would get in around 6 a.m. You may need to get in earlier depending on your patient burden or how complex your patients may be or how comfortable you are with your list. But generally speaking, you come in around 6, get some time, put your stuff down, and then you want to gather information. You want to go speak to the relevant people who are on overnight. And then you really want to jump in and start seeing patients. So we're going to talk about strategies on how to figure out who you see first and which people to prioritize. But you're going to want to spend the next half an hour to hour seeing your patients, getting in the room, making sure they're doing okay. And then the last portion of your morning is really spent sitting in front of the computer with the phone next to you, handling some business, enacting parts of your plan as much as you can before rounds start. So these are 4 daily tasks that are required of every intern and sub-I as you go through the year. This is basic, simple stuff, but it's important to just talk about it discreetly. So you want to make sure that you're interviewing and examining patients every single day. You want to make sure you're looking at every single person on your list, and you want to make sure you're seeing them once before rounds. You want to make sure that you're putting in the relevant orders for those patients and to make sure that your plans are actually happening in the computer. And then finally, you want to have some documentation. So you want a daily progress note on every patient, and you also want to make sure that you have your handoff updated at the end of the day. So these 4 things have to be done for every single patient on your list every day. In terms of the order of priority, how do you manage these tasks? So I always tell interns, you really want to put your patients first. So always lay eyes on your patients before anything else, because if they look different in the room, the rest of your morning is going to be different based on what you've examined and seen. So you want to go see your patients. Then I prioritize putting in orders because your plan can't happen unless there's an order in the computer. So you want to make sure that your orders are going in. You can have the best note in the world, but if those orders aren't in, it doesn't really matter. So you want to put patients first, then you want to spend some time writing orders, making sure those the nurses and everyone know about your orders, and then spending the remaining amount of time documenting appropriately. So how do you stay organized in terms of these tasks? There's a lot of different organizers out there. This is one that the program directors like to talk about. This is the 4-box method. So essentially each patient has these 4 boxes next to them. And as you complete these things every morning and throughout the day, you can just check things off. I have a little bit of a different system, but it's generally about the same as the 4-box system. Whatever works for you, I think, is the big takeaway from this is you want to keep organized. You want to keep lists. Dom, our program director, likes to say he always likes interns who have lists. I think most residents feel similarly. We want you to have an organized system to keep track of what you're doing throughout the day. So who do you speak to in the morning? It can be kind of confusing gathering information on patients. So depending on what type of patient you're dealing with, whether it's someone who's brand new to you or whether it's someone that's already been on your list, you want to get sign out. So sign out entails talking to the night crew. So sign out on your old patients, depending on your site. At Rhode Island and the Miriam Hospital, it's going to come from the NF1, the Night Float 1. So that's an intern that's responsible for cross-covering overnight. They're going to have your list in hand so they can tell you about any overnight events. They may have nothing to report, which is a pretty good thing, and sometimes they may have a kind of big thing to sign out. So you always want to make sure you're touching base with the NF1. If you're at the VA, the cross-cover individual at night is the NF3. If you're getting new patients, you're going to want to talk to the night float too. It is their sole responsibility to admit new patients overnight. So they're the people to talk to about your new patients. Sometimes the NF3 may step in to do some of those admissions. So you just want to clarify who to get sign up from in the morning. Most importantly, you want to make sure you're getting in there early to talk to the nurses, especially the night nurses. Some things may have come up that may not have actually made it back to the NF1 or the NF3, so you just want to make sure that you're touching base with the nurses to get their take on the evening. They also may have a different version of events depending on what happened, so it's always good to get as much information about the night as possible. And then finally, you want to talk to your patients. You want to make sure that they're doing okay because certain things may not have come up. They may not have verbalized certain things to night float people overnight. So you just want to make sure that their needs are being addressed appropriately. So, how do you triage your morning? I think there are a number of different things that our mornings are filled with, but essentially the big things are you want to make sure that you're getting a good handle on overnight events because that's really going to dictate the course of your day. If something big happened, you need to know about it. So, overnight events are really the preeminent thing to get when you first get in the morning. Then it's really about seeing where your patients are clinically, and you're going to use vitals and lab work as well as your exam to kind of understand where your old patients are. You're also going to be working through some new patients, so you want to make sure you're keeping an eye on those people as well. They have had good care over the night with the NF2 or the NF3, so you want to make sure that you're picking up the torch capably in the morning. So dropping eyes on those patients early is always a good idea. And then finally, you want to preempt your day. So you want to think about early discharges and early consults because these are things that are time sensitive. So if a person needs to go to a specific nursing home by, say, noon, you need to have your ducks in a row before you can discharge them, and you may not be able to do as much while you're on rounds. Similarly, you want to know who you might need to call if you have any early consults in mind. Say one of your patients had a GI bleed overnight and now you need to get GI involved. You want to be thinking about those things as you're going through your morning and run those thoughts by your residents and maybe your attending if they're around. One of the trickiest things about your morning is managing the amount of time you spend in the room with patients. Patients are your priority in the morning. This is your one and only time to make sure you're getting your version of their story before rounds and before your consultants and everything. So it's the best time to meet your patients is in the morning. But you want to be sure that you're using that time effectively. So I had a senior resident tell me to be conservative but conscientious. So you want to make sure that you're not repeating every single thing every single day, and that you're using your time to be targeted and to be understanding of where these patients may be in their hospital course. So you just want to check in about overnight events, make sure that you discuss any issues that the night float may have signed out to you. Maybe they had some nausea overnight or some chest pain or some shortness of breath. You want to be sure you're talking about those things with them in the morning and making sure that they have a sense of comfort about what the plan is going forward for the day. Then you want to give them a chance to bring up any new issues that may be developing over the course of the morning, and spend some time talking about those things. And then I think the big thing is to really take it back and get into a rudimentary plan for the day. So where do their overnight events, their morning concerns fall in the course of their overall plan for their hospital stay and what may be taking place over the course of the day? And similarly, you want to make sure that your exam is focused and systematic in line with that plan. So if someone's coming in with pneumonia, you really want to make sure you're listening to their lungs, getting a sense of how sick they look, if they've had any productive mucus or things like that. You don't really need to spend a ton of time going through a very thorough abdominal exam or a neuro exam that may not necessarily yield as much in terms of their plan for the day. Orders are pivotal to your morning. Early orders get the worm, so to speak. So you want to make sure that your orders are in before you start talking with your senior resident. Everything that you put in has to be co-signed. So this is your opportunity to put your money down, to make sure that you're making a statement about what you think the plan is going to be going forward for the day. Your seniors are going to be reviewing those orders with you and hopefully signing the appropriate orders as they see fit. But I encourage you to place orders before you start talking to your senior, just so that it streamlines things for them, and it also gets you to commit to a sense of a plan for the day. Remember, orders do not live in a vacuum. You've got to talk to the nurse. So anytime you think about putting in an order and then having your resident sign it, that's not where the conversation ends. Your next thought should be walking over to the nurse and telling them what you just did, because that's going to be the way that this actually gets affected in real time. You want to take some time to do some medrecs on your new patients. The night flow crew is really busy and they may not have all the resources available to them to do good medrecs overnight. So you want to be sure that you're understanding their medications on your new patients as they come in overnight. And then obviously you want to be sure to put in your consult orders if you're going to call someone. This is really just to help these people write their notes. It's not particularly back end related. They don't see the order and then come and see the patient. It's always placing the order and calling someone. And then there are time-sensitive meds and orders that I think are really important to review every morning. So you always want to make sure your patients are on the appropriate antibiotic regimens, and that if something's about to end that day, that there's an end time. Similarly with IV fluids, I would say the same thing stands. Narcotics may need to be reordered depending on what is going on with the patient. You always want to make sure benzos are being reviewed because your patient may have been on CWA and they don't necessarily need the benzos anymore. So you want to make sure you're looking through that stuff. Anticoagulants, depending on where these patients may be in terms of a potential procedure, making sure that those things have been stopped appropriately or started back appropriately. Making sure you're reviewing the amount of insulin patients have gotten overnight, as that may change the amount that you give them during the day. Reviewing telemetry and Foley orders, and PT and OT and restraints. These are all things that are geared towards efficiency for the day. The hospital gets dinged on them. The nurses get unhappy when the orders aren't in for these things. So you want to make sure that your patients have the appropriate orders in if you plan on continuing these things. So I've been harping on consults. How do you actually call a consult? So the nitty gritty for how you call a consult, the extension is 33232 at Rhode Island and Miriam. That brings you to the operator. At the VA, it's the extension 0. And once you get a hold of the operator, you're going to ask them to page the appropriate consultant back to your line. At the Miriam, it may be an attending, not a fellow. So you just want to make sure you're clarifying who you want. And there are different nuances to who you're calling, but you can ask your senior to help you figure that out. But in general, you're calling the operator and you're asking someone to page you back to discuss a consult. But that's one part of it. The real part of how you call a consult is in the conversation. So if possible, you always want to make sure you're calling early. Consultants hate getting called at 4 p.m. So be sure to call early if possible. As soon as you know that there's a consult, your priority should be trying to call that consult. You want to be a person. So these are busy people, and you want to be considerate of their time. And just if you know them, it's always nice to say, how are you doing? How's the day going? It just endears you to them a little bit more and helps make things a lot easier, I've found. Then you want to introduce yourself. They may not know who you are and where you're calling from, so you want to always introduce yourself, what your role is on the team, and that you're placing a consult on a patient. That's basically the first and foremost thing that they're going to want to know is, why are you calling me? You want to give them time to process. They may be walking in a hallway. They may be at a phone in the ED. You just want to give them time to get Epic open, get their paper out in front of them, be able to take down the information as you're about to present it. You always want to have your information ready to go. So name, date of birth, and the location in the hospital are all very important things to have in front of you before you start calling the consult. The consultants are going to rely on you to help find this patient in the chart. So if you can provide them with that information quickly, that'll be super helpful to them. You're going to want to describe your consult. So be very up in front about your consult. The consult question should not be the last thing that comes out in the conversation. It should be the very first thing that comes out in your conversation. So I'm placing a consult because I'm concerned that this patient has a GI bleed and may need an endoscopic evaluation by the GI team. So right first and foremost, I'm not mincing my words here. I'm concerned about GI bleed, and I want the GI docs to come and take a look. Then you can get into the entire story. This is a 75-year-old lady who's been popping, NSAIDs left and right for back pain, and she's got melanotic stools, and I'm worried that she's got an ulcer. And that's a relatively short story, but you have basically told them what you are concerned about, and then you can jump into the story, and you're going to be pertinent about your story. So they don't need to know, oh, this patient had an AKI, oh, this patient's on antibiotics, oh, this like they don't really need to know all that stuff. If their job is really to come take a look, they need to know what's going on with the bleeding. So relevant meds, the time course of the bleeding, and what you think is going on. So you want to be sure that you're being relevant in your discussion with their consultant. If they have questions, they're going to ask you more. So feel free to be on the briefer side. They can certainly help steer you in the right direction to give more information. So I always describe my consult right up front, give a pertinent one-liner, give a pertinent hospital course, and then I always restate my consult question at the end, just so that everyone's clear on what we're doing. And then finally, I like to wrap up my consult calls by asking some very logistical questions. Are they going to see the patient today, and how do they get back in touch with me? So either by pager or cell phone, either is appropriate. You can also give them an extension if it's something more urgent. So in general, that's how you basically call a consult. You want to be early, you want to be clear, you want to be upfront. How do you manage the rest of your morning? So that 7:30 to 9 a.m. period, at some point you're going to be going to morning report and all this too. But I think other things to keep in mind is you want to do your second set of chart review. So you're going to look at your labs and imaging that are going to start rolling back in at this point. You're going to look at previous day consult notes that may provide more insight into the plan going forward. You're going to want to look back at what your attendings may have written back at like 6 p.m. or so. You're going to want to review their active meds and make sure that they're appropriate to the plan that you have laid out for yourself today. You're going to want to talk to the nurse and case management early. And this is really to help identify patients that might have certain needs for discharge, like PT. The case manager may say, oh, they need a new PT eval to go back to a specific nursing home. So you want to make sure you're touching base with them early. Generally, case managers get in around 8. You want to start your note. I say start your note. It's ideal to have your note finished by rounds, but that's maybe not going to be a super attainable goal for you guys at this point in your career. So starting your note, I think, is a really good thought. And then the bigger thing is to really have an outline of your plan for the day, just so that you're ready for rounds and you're able to kind of take people through what you're thinking the rest of the day is going to look like for this patient. So that's all I've got for you. This is how you manage your morning. Hopefully this was helpful. If you have any questions, feel free to email me. These are both my email addresses. You feel free to page me as well as necessary. And we look forward to seeing you on the wards, and good luck.